Hi, Gary Smith from Allegiant Physical Therapy in Durham, New Hampshire, checking back in, this time to talk about sciatica. Sciatica is a painful condition that can develop and cause pain that travels into the leg. It's a little bit of a different problem because it can actually cause different kinds of symptoms, from pain to numbness or tingling, and it can also be located in different positions. Sometimes just in the upper part of the buttock, other times in the upper thigh, sometimes the front of the thigh, sometimes the back of the thigh. It can even travel down into the calf and into the foot itself. And again, these symptoms are not just limited to pain, but also can be characterized by numbness and tingling, or even weakness in the leg. So with this type of problem, it's interesting that the actual problem that we're dealing with is not in the leg necessarily itself, but typically more in the low back area. So sciatica is named for the sciatic nerve, which is the major nerve that travels into the leg from your low back. And it's a collection of smaller nerves that joins together and goes into the leg from the low back. And typically it's one of the smaller nerves in your back that's being irritated by some other structure, whether it be a disc or a bone related to arthritis or that kind of thing. But in any case, it's irritation of the nerve in your low back area that in turn causes that pain traveling into the leg. And of course, it runs the gamut in terms of its intensity. You can start to limit your ability to stand and walk. And in other people's case, sometimes it's the sitting and driving that they have a problem with. It just kind of depends. People develop different kinds of limitations because of this problem. In physical therapy, we try to address this problem using natural means of behavior modification and education, and especially with different kinds of exercises, including mobility exercises and even strength exercises, to naturally deal with the pain problem and help you get better. So we're going to look at a few exercises in this case that are really good for sciatica because they help to mobilize the sciatic nerve to help it move more freely when you move. So when you're changing positions or you're getting out of a chair, it helps to free up the nerve so that when you want to move from one position to the next, your sciatic nerve will more freely move with you. So let's take a look at those exercises. This is the first of our sciatic nerve mobilization exercises. In this case, our patient is doing wall slides. And it's simply a function of getting close to the wall with your backside, lying on your back, and then slowly sliding your heel up the wall until you feel that stretch behind your leg. It can be a little uncomfortable if you're dealing with a sciatic problem. The key here is to go and just until you feel that stretch, but not a lot of sharp pain by any means, and to stop at that point, pause for 2 to 3 seconds, and then bend the knee and release the stretch. Typically we'll try to do those 30 times in a row. And this exercise can be modified by either sliding the leg up and in other words, towards the center of your body, or up and out toward the outside of your body. When you slide toward the inside of your body, you'll get more stretch on the nerve. And if you feel like you need to start with a little less stretch on the nerve, you can slide up and out. If you want to take this exercise to the next level, you can do it in a door jamb so that you can lie your opposite leg flat down on the ground while you do the heel slides. This is the second of our sciatic nerve glide exercises. This I call a modified slump glide. To start the exercise, Casey's going to bring his head down towards his chest while sitting in an upright position. After that, you'll see him incline his body backwards, again keeping his back straight but supporting himself with his hands, and then straightening his legs to whatever degree he can tolerate. While you straighten your legs, with this exercise, the same rule applies. You want to go as far as your condition will allow you. If you're dealing with sciatica, you might feel some extra strain on that side that's sore, more so than on the other side. But again, you want to achieve a little bit of a stretch here, but not a lot of pain. So you need to do it comfortably, but in a way that challenges you a little bit. In this exercise, you also see Casey here, when he extends his leg, he'll also flex his feet up towards his head, and that's going to provide him a little additional stretch through the nerve. 30 times is your goal. With this, you can break it up into sets if you need to or want to. And again, be sure to do it to your tolerance. So these are sciatic nerve mobilization exercises to help your sciatic nerve to be able to move more freely when you move. You should try to look for improvements on a day-to-day or a week-to-week basis. You have to kind of chip away at it little by little, trying to make little small improvements. Don't try to do a lot all at once because you may not tolerate it very well. But these exercises can help you. If you have a problem with it, be sure to seek out your favorite physical therapist or visit your doctor if it doesn't seem to be recovering. But thank you for tuning in. My name is Gary DeSmith from Allegiant Physical Therapy in Durham, New Hampshire. If you appreciate the video, please like it and let us know if it helps you out. Please leave us a comment. Thank you.